Well, the holiday season is usually a time when many of us overindulge. I mean, who does that? Who overeats? Who does anything like that every time? Anyway, but you know, the big dinners, the festive parties, and the busy schedules are often a recipe for something that has actually been in the news a lot of recently, and that is heartburn. Yeah, that's right. So please help us welcome Dr. Vikram Gopal to the show today. He's a gastroenterologist at the Borland-Groover Clinic. So welcome, Dr. Gopal. Thank you so much for joining us. We've heard about heartburn recently because it was, who was it, President Obama? He thought he had a little bit of a sore throat, but it was actually heartburn. So what exactly is heartburn?
Heartburn is a variety of different symptoms for people. It can be a cough, it can be irritation, it can actually truly be chest pain for some. And it is a burning sensation. So everyone has different symptoms for acid reflux and heartburn, but it's usually when acid leaves the stomach and enters the esophagus, and the esophagus doesn't like it, and you definitely feel it, and you'll feel the complaints.
Well, and that's the way, you know, it's so interesting with President Barack Obama, because you saw the big motorcade going to the hospital to go get a CAT scan because they had no idea what this was.
Correct.
And it ended up being heartburn. So if somebody is watching out there and they're experiencing something perhaps similar to what the president experienced and they weren't sure what it was, what are the symptoms that we need to be on the lookout for?
So if it's just minor discomfort after eating a large meal, overeating, consuming maybe some fatty foods, alcohol, carbonated beverages, then you should take some antacids to see if that resolves your symptoms. If it does not, then it could be something more serious. It may need to undergo an endoscopy and to take a look and see is there some chronic damage to the esophagus that could lead to cancer.
Well, so let's say it might be something more serious. How would you go about treating heartburn if we do in fact find out that, yeah, we're frequently experiencing heartburn?
Right. Believe it or not, 10% of the U.S. population every month has acid reflux. So it's
I believe it.
Yeah.
Yes,
very common.
It's stress-induced, right?
It can be, right?
It can be induced, but it's mostly for the things you talked about, overindulging. We eat a lot of spicy foods, we stuff ourselves, we have desserts, dinner mints, we actually take a nighttime cordial, we actually eat too much before we go to bed, we lay down, we don't sit up right after eating. These are all reasons why we have acid reflux. Tight-fitting clothing and obesity is also something that leads to acid reflux.
So then how could we treat it, let's say?
So very good. I think it's moderation, portion size. Do not overeat.
Sure.
Small meals, and then sample things during the holidays. Don't sit there and clean your plate. And then with that, take your time, chew your food very well. I think
that makes a difference.
It does.
So what about those Pepsid AC and those things that you see and they say take before you eat a lot? Is that going to help mitigate it?
It will. It's a temporary fix. It's not a long-term solution.
Well, let's talk about why it's so important then to make sure you get a solution, because sometimes I'll just tolerate it. I know I have it. I just deal with it.
I think it's normal.
And yeah, it's just part of it. But it's so important if you have this chronic problem to get help. Why is that?
Right. A lot of people don't realize what it is to live without acid reflux. They think it's normal to burp or belch or to have that sore throat or to have this bad taste in the back of the mouth or a cough. And actually, that's not normal. And what you should do is talk to your doctor about it. And if you are the ideal patient, you should start on a medication. There's multiple ones out there, Prilosec, Nexium. You see them over the counter. There's also prescription medications that will help you. And you want to prevent it instead of chasing your tail and just treating the symptoms.
So what's your best advice for someone? Let's just say that I'm thinking that I'm experiencing it. What's that kind of magic number where I should kind of maybe get serious about what it is that I'm doing and how I'm going to fix it?
If you're having it more than one time a week, I think I would discuss it with your primary care physician. And if they think it's necessary for you to see a gastroenterologist, then you should be referred to see one of us and most likely, you know, undergo an evaluation and to take a look and see what are your symptoms, what can we do to improve them, and what tests do we need to run to make sure there's nothing serious.
And you said if it is left untreated, it could potentially lead to cancer, which is why it is a very serious thing to take care of.
Very serious. And so it should be looked into and should be evaluated because prevention is the biggest key here.
So what are some of the things that you would do at your office if someone came to you with a pretty serious condition that could be leading to something else? How would you go about assessing it?
If you've been on acid suppression medication or you have not, and you start having difficulty swallowing, if food is getting stuck and not going down, if you notice any vomiting, if you have bleeding or coffee ground emesis as we call it, or you actually notice blood, or you lose weight and you don't know why, you should undergo an endoscopy. And that is a procedure where we pass a video scope into the mouth, esophagus, stomach, and small intestine, looking at the lining, the mucosa, to see if it's healthy. Is it damaged? Is there precancerous changes, or is there even cancer? Sometimes we see strictures, and those strictures can easily be dilated to expand the esophagus.
All right. Well, Dr. Gopal, thank you so
you.
much, sir, for being
Thank you.
here. We
Yeah, great to
appreciate
meet
it.
you.
Happy holidays.
And thanks for the important information. And thanks as well to the Borland-Groover Clinic for sponsoring this segment.
Yeah, if you'd like more information or you want to schedule an appointment, just call 1-866-268-3297. Numbers on your screen, or log on to borland-groover.com.